Hey everybody, we are here at Supplies Overseas headquarters, and Denise Sears has just returned from her trip in Africa for 2 weeks. And if you've been following our Facebook, then you've seen a couple pictures, you've gotten a few updates from her. I know we've been communicating through WhatsApp and Instagram, so we wanted to sit down and have a nice conversation. She can tell everybody about what she saw, the experiences that she had. So to start, you went to Nigeria. You started in Nigeria.
Right,
And
yeah.
then,
So I was in Nigeria for the first 3 days, spent some time in Abuja, and from Abuja flew up to Borno State, up in the north, a rather, an area really rife with conflict. I went to a refugee camp. People have been displaced from their homes in the villages by insurgents, and it was just devastating to see the conditions that these children and parents are living under. Very makeshift dwellings, very makeshift, no medical care, very limited water, very limited food. Then went up to Kano State, visited a hospital there that is in desperate need of our help. I was really impressed throughout the trip with the quality of the medical professionals, but they're in so many cases operating in a desert with no supplies and equipment. And at this particular hospital, there was a little baby who had encephalitis, and they didn't have the supplies they needed to relieve the pressure on her brain, and it was clear she was going to pass away probably pretty shortly. But to see her, being cradled by her mother and knowing that there was nothing they could do was heartbreaking.
he told us yesterday that the doctors and the staff had the skills to save these lives. They just didn't have.
Really impressed with the staff at this particular hospital, and they keep running out of gloves, and patients have to try and resource their own gloves when they get admitted to the hospital. So it was pretty heart-wrenching.
And then you went to Ghana, where we sent two containers actually in January of this year. 3.
2 in January and 1 in April. The 2 in January went to the UDS hospital in Wa, and they were so excited to welcome us because they're so grateful for the supplies and equipment that we sent to them. They went through every single room, through the surgical suite, through inpatient rooms, through their new lab, and based on the, they had almost nothing before they received these 2 containers. And ironically, they were very appreciative of everything, but even the bedside tables, they're using them not only next to the beds, they're using them to store things in the lab. So they're making everything useful that they received, and so that was very impressive. And then from there, I went down to Tamale. Depends on who you talk to in Tamale, whether it's Tamale or Tamale. Dr. Seth Wanye, who I visited at the Friends Eye Clinic, says Tamale, so I'm going with that.
Yeah, we were debating the whole time you were going.
I did Tamale. Our driver said Tamale. Dr. Seth says Tamale. So Dr. Seth Wanye received a container in, I believe it was April. He does surgeries to restore sight for people that have cataracts. And there was a whole room of people that were going to be receiving surgery. He did 52 eyes that day.
Wow.
Some people had both eyes. Most of them had just one. There was this young boy, 9 years old. He's blind in one eye due to an injury, but he had developed a cataract in the other eye, rendering him blind. So he couldn't go to school. I actually was there with him through the prep for the operation, and then
You said he was being led around by his father.
yeah, and so we did the surgery, and Dr. Seth Wanye was pretty confident. He knew he'd get some sight back. The question overnight was, will it be sufficient to allow this young boy to return to school? So the next day, all the patients come back, and Dr. Seth Wanye takes off the bandages, just one by one by one. And so we got to Anusha, that was the young boy's name. He takes off his bandages, and you could just suddenly see this boy's face break into a smile because he can suddenly see.
Yeah.
One of the most poignant moments for me was he and his dad were getting ready to leave, and they were on their scooter. And the young boy looked over and saw me standing outside, got off the scooter, walked over to me on his own to extend his hand and thank me as a representative of, he's thanking Supplies Overseas. I mean, I was just the body there, but to see him walk over by himself when the day before he had to be led where, so he was scheduled to return to school this past Monday. So I have to follow up on that.
Yeah.
Yeah.
Absolutely.
Yeah. And then from there I went to Uganda. And when we flew into Uganda in Entebbe, we were then going to travel to the northwest. It is a very impoverished area. For those who remember their political history, it was kind of the seat of Idi Amin, so very war-torn, through, up until, the 80s, and it takes communities that are already poor, it takes them decades to be able to recover from something like that. So there's a clinic there, the Mama Sabina Community Health Center, that will be ready to open in a couple months. They have been working on it. The villagers have been working on it. We were there, and they're building a brick wall around the building so that if your child is in the hospital, you can be there, you can sit outside or be inside. So that's basically their waiting room for the hospital is this brick wall around the clinic. And the children in Caspir village were some of the most beautiful children that I've ever seen in my life. They, despite the fact that they're, in tattered clothing, several of them are clearly suffering from malnutrition. Every one of them was smiling, just exuded joy. I mean, they are just so grateful for what they have.
Yeah.
That reminded me that we all need to express deeper gratitude for what we have. They are role models.
Yeah, absolutely.
And so it was reassuring to me to know that a container will go there at some point in the next year.
Yeah. Yeah, I know that was you told me that story yesterday morning about, they were singing, they were smiling,
Yeah.
still had a reason to find joy, and you told us our, tagline is sending health and hope across the globe. But you said yesterday that has a totally new meaning now that you've seen it up close.
Everywhere I went as a representative of Supplies Overseas, they look at us as their hope. I mean, I've never. It was humbling. It was so humbling, but we are their hope. Yeah. And seeing this young boy's eyesight restored, we all get into routines, and you start saying your tagline, and it just rolls off your tongue, health and hope. I say it so differently now because I saw it. I saw the health and I saw the hope.
Yeah. That's amazing. Yeah. And we're glad that you're back to share the stories with us.
I'm glad you're back too.
And they say, Denise says we're the hope, and it's not just us sitting here, it's our volunteers.
Absolutely. And our hospital partners. What I witnessed, I wish everyone could have seen through my eyes. And I'm going to try very hard to kind of circulate around and talk to people to share this, to convey the magnitude of what Supplies Overseas does, which they can't do without their volunteers, with their donors, with their hospital partners, with their staff, with our board of directors. I mean, it's a collaborative effort. I was just I was the embodiment of our mission to go overseas. All of the adulation and the hugs, I bring back to everyone because it is all for you. You are their hope.
Well, we're glad you're back. We're glad that elephant didn't get you.
Yeah.
So,
I did have a little encounter with an elephant. That's another story for another time. You can private message me and I'll tell you about the elephant. But yeah, I did survive. So thanks everyone.
yeah, we'll see you next time.
Okay, bye-bye.